once you have that experience inpatient, you start to see like, oh, this is what somebody who's truly manic looks like. It's like you're seeing the very extreme of what true major depressive disorder is.
What is something that you feel like is the most profound thing that you've learned from your patient?
I've seen people from all walks of life suffer from severe psychosis. Sometimes we want to do everything on our own. We want to credential ourselves. We want to learn the billing ourselves. We want to do everything ourselves.
Yeah.
I think that's a huge mistake.
I don't want to start my practice right away because I definitely want to like work under somebody and grow and like make sure I know what I'm doing. I kind of did what I did in 3 days.
Okay.
When I become an NP in the future, like how I'm able to look at my patients, like get them the proper diagnosis that they need at that time.
Yeah.
How do you do it?
So I'm a nursing student. We're here at FIU in the Graham Center with Dr. Mesa himself.
Thanks for the intro, man. So talk to me, Jack. So Jack's actually been a follower of mine for a couple of years now.
2 years.
And so I was invited here to FIU to speak to a group of students, but as you can see, nobody showed up. So this is called Free Game Thursday, and Jack has plenty of questions. He has high aspirations in terms of what he wants to do in the field of nursing, and I'm excited to sit here and just talk to you, man. It's a pleasure.
Let's do it. Absolutely.
So tell me, I know you had a couple of questions that you were kind of just ready to rattle off, so let's get into it.
So I'm, I graduate this month with my BSN, and I'm applying to the MSN program now for psych, right? So exactly what Dr. Mesa does. And I guess I want to know first, like, what should I expect from the MSN program? Like, is there anything that I want to be prepared when I leave? I want to be prepared to like practice. I don't want to just get my degree and whatever. So, do you have any advice on that or things to prepare?
I think it's obvious that anybody's going to be concerned. You're stepping into graduate school. You're not sure about like what to expect.
Yeah.
I think one of the most, like, if you're doing well right now academically in the undergrad program, are you in the accelerated or traditional program?
The traditional.
Perfect. So you're in a traditional program right now. Have you had any issues in terms of schooling, academics, grades?
I have 4.0.
4.0?
Yeah, through all the nursing classes, yeah.
So you're killing it.
Yeah.
Magna cum laude, maybe.
Yeah.
Is that what you're going for?
Definitely.
Yeah?
Yeah.
All right, cool.
Yeah.
So I really don't anticipate any issues with you in graduate school. It's probably going to go really well for you. The main thing that I encourage all students to focus on is getting the best clinical experience possible. Although a lot of students do, I wouldn't stay with just one clinical rotation. I would definitely try to get as much experience as possible. Maybe going to a drug rehab and detox center.
Okay.
Maybe going to an inpatient psych center, then going to outpatient. I find a lot of students that are coming through some of these other institutions that are using my site as a clinical rotation, they just want to stay. And I feel like, sure, you can learn a lot that way, but it's so much better to get more exposure to what's going on around you.
Okay.
So that's the best advice I can give you. Other than that, just keep applying yourself and doing what you're doing, because it sounds like you're going to be very successful.
Okay, so inpatient and outpatient, do both. And then do some, like, is there any like specialty? If I want to, I think what drives me the most right now is like outpatient psychiatry, because I like the idea of like seeing a patient, change and grow and adapt and everything like that. So, what inpatient experience would you say is best for that?
So any inpatient experience, because when you're working in the outpatient center, the percentage of people that actually end up like inpatient,
1%,
it's so low, right? Well, depending on what population you're serving too. But once you have that experience inpatient, you start to see like, oh, this is what somebody who's truly manic looks like. This is somebody with suicidal ideations or a recent suicide attempt, how they behave. Somebody who's in a state of depression where they're literally laying in bed and they have no desire to get up urinating on themselves. Like, you're seeing the very extreme of what true major depressive disorder is, right? So once you see that, now you have a gauge in terms of, at what point should this person be Baker acted? At what point should I just be seeing this person twice a week? At what point should I be referring them up to an intensive outpatient program?
Got it.
So it's a little bit different than just only having outpatient experience, and you get somebody who maybe can have a step up in care but doesn't need to be Baker acted.
Yeah.
But you're thinking Baker act because you don't know what that looks like. So I think the more exposure you get, the better off you're going to be.
Got it. That makes sense. So like, okay, that makes a lot of sense.
Yeah.
Yeah.
Or excuse me. So for, let's say, with somebody who's detoxing off of drugs, like, or somebody who you feel has a substance abuse issue, when you have worked detox, or you have worked in an inpatient center where they have been detoxed, and you know what that looks like and what it feels like for the patient, and how are you able to manage that before it happens?
What is something that you feel like, a life lesson that you feel like you can learn and like teach other people when it comes to being a psychiatric nurse practitioner? What is something that you feel like is the most profound thing that you've learned from your patients?
Most profound, you're coming with a heavy question walking across the parking lot.
Yeah.
So the most profound thing that I've learned is just that mental health can impact anyone and everyone. And it doesn't matter what socioeconomic class you come from. It doesn't matter what your background is or how prestigious your title is at work. It's all irrelevant. I've seen people from all walks of life suffer from severe psychosis, manic episodes. So yeah, I think it's just that it does not discriminate, no matter what.
It is.
I think that's the main thing that people don't realize is that you start to think, like, if you guys do rotations at Jackson Memorial, you start to realize, like, oh, this looks like all people from a lower socioeconomic class. But that doesn't really reflect everything that's going on, because now I can take you to a detox center in Boca or Delray, and it's people who are paying $60,000 a month to be at that center to be detoxed. So yeah, it just does not discriminate, and people will do anything and everything to try to help their family member or help themselves. So
I kind of saw that at Mercy. Like, there was a
oh,
lot.
here.
I kind of saw that at Mercy. There was a lot of people that were, from that lower socioeconomic class, but then there were a couple people that lived in Brickell that, were taken there by the police and that, had nervous breakdowns and stuff like that. It was I felt for them because they were in an environment that was completely foreign to them, and they had to be around, different people that, it was just like, it seemed like it was kind of, it would make me nervous if I was them, but like, if they got the help they needed, that's what matters.
Yeah, I think one of the best examples of that is like the Idea Exchange program. Do you know where it is? Or do you know what that is or no? The Idea Exchange is a needle exchange program. It's Florida's first needle exchange program. It actually exists right across the street from Camilla's house. And when I was just touring there with my buddy Eddie, who's a psychologist, he was just explaining to me, you think that it's only the homeless and the people who are sleeping on the street around here who are coming in to get clean needles and everything that you need to self-inject or self-administer. But there's people who are pulling up in Benzes that just need access to needles or need access to whatever they have.
Yeah, clean needles.
Yeah, and so it was teachers, everybody, business owners. And so then you start realizing, this is impacting everyone.
Wow.
Yeah. And again, that's not what you're going to see in the outpatient setting. The outpatient setting is, for the most part, people who are suffering from depression, financial issues, maybe marital conflicts, job loss, stuff like that.
Yeah. Got it. Jack, do you have another question you want to ask?
Jack is still recovering.
I have a question. So I have a question. So Adrian, I don't want to start my practice right away because I definitely want to like work under somebody and grow and like make sure I know what I'm doing. I kind of did what I did with real estate.
Okay.
But when you started your practice, is there any steps that you would do sooner than what you did? One, and then I guess the second question would be, what steps did you do that you really thank yourself for?
No, I think the time was just right. I think my timing was perfect, actually, in terms of when I started to play with the idea of it's time to go on my own. I had the experience working at Camilla's house. I had the experience working at different outpatient centers, nursing homes. I had already worked inpatient as a nurse and doing detox as well. So I just felt like, I've gained so much experience. I think I'm ready.
Yeah.
And so timing-wise, I think that was perfect. The second part of your question was, what are some things that I guess I'm grateful that I did do in that time frame, was just making the decision to go. And initially, I started off thinking it was going to be a cash-based business, and I learned very quickly, like, this is not going to work. Most people do want to use their insurance to pay for mental health care, especially if I wanted to be a group practice and grow. And I was 100% right, because when I was trying to go the cash route, I was getting phone calls and phone calls and phone calls, and the first thing they would say is, "Do you accept Blue Cross? Do you accept Aetna?" And then after a while, I was like, it's time to hire somebody who can help me deal with the insurance side.
Completely.
So if anything, I think people are hesitant about that first hire, right? When you start working, you're going to need to find somebody who's going to get you going. Sometimes we want to do everything on our own. We want to credential ourselves. We want to learn the billing ourselves. We want to do everything ourselves.
Yeah.
And I think that's a huge mistake. I think if you just take some of that money and invest it in someone, obviously somebody who has the skills that you need, it's going to take you a lot further, a lot faster.
So the first person you hired, was that somebody that already worked for
Another
a doctor?
practice.
Okay, got it.
And just all they needed was to understand, I guess, the workflow of a practice, understand insurance, and understand credentialing.
Got it.
Not marketing, not nothing else.
Yeah.
Insurance, credentialing, and being able to bill on the back end.
Got it. Cool. Jackie, do you have
I'm ready. Okay, because I really want to go into something that I think is a little bit niche, which is basically children and adolescent psychology.
Okay.
And I think that that's something that I really have a passion for, but I feel like there's not really a lot of opportunities that I've come across. And right now, there is an opportunity where I went to, like right now for practicum, but I really want to be able to keep my options open in the future. And I feel like that's something that I'm struggling a little bit to like navigate, because I don't know where to go in terms of school, what to do in terms of experience, and where to basically set my foot down. Is there anything that you can recommend? Have you worked with kids? Have you worked with a lot of adults? Like, how does that work?
So I started off my career in pediatric ICU. So the first thing I will tell you is, don't be afraid of jumping into whatever you have a passion for, because you can always pivot. I jumped from pediatric ICU, and when I wanted to get into psych, everybody told me was, why are you going to go work with those people? There's no opportunities for you there. Nobody's ever going to hire a psych MP. You're going to lose your skills as a nurse. I used to be able to hang a Milrinone drip, a dopamine drip, an epi drip in a pediatric ICU, managing a child who was, post multivisceral transplant.
Yeah.
Right now, I would require some additional training to do that. Losing those skills at the bedside does not impact me today.
Yeah.
The main skills that I gained at the bedside that still help me to this day is, how did I communicate with those parents at the bedside who are having a child that is dying with them? Yeah. How did I manage the chaos of a code? How did I keep myself calm when everybody else is running around with their heads cut off, and me realizing I have to be the calm in the storm? Yeah. And I think all of those things that I learned then still help me today. When people are panicking around me, I need to step back and say, wait, I'm solution focused. What's the problem at hand, and how do we solve it? I'm not going to get caught up in the emotions of the moment. I need to solve this problem. And so I don't think there's any direction you can go in that's going to rob you of anything else. I think everything else is just going to build on top of it. So if your passion is to work with kids and adolescents, pursue that. Yeah. But be ready 2, 3, 4, 5 years down the road when you say, this doesn't excite me anymore. You have to prepare yourself to say, how do I step away from this now? The mistake that a lot of nurses make is they stay at that bedside, they stay with that population, and they are miserable people. And I'm not lying, if you guys have worked on the floor in any of these hospitals, you have met people who are working in direct patient care who are not happy with their jobs and who probably shouldn't be doing what they're doing. Yeah. So don't be them. Don't be them.
Okay.
Yeah, because you don't want to carry that baggage and that lack of fulfillment home to your family, your kids, your significant other.
Yeah. What are some things that you feel like you have done in your personal life and your life outside of being a nurse that has made you feel more comfortable in being in a room with people that have their things that they're dealing with? Because I think that that's something that I'm still learning to figure out, because when you're talking to people that have depression, anxiety, they're going through psychosis, they're going through all of these things, how do you keep yourself centered and keep yourself focused?
I mean, that's about self-care. Like managing people is always going to be easy because you know that you are in the position that you are there to solve the issues and help them through it, and you're not in that issue with them, right? They can have some of the worst things that you can imagine that happens to someone, and you are just there to listen, to be there for them, to help them through it. It's not necessarily your problem to take home with you.
Yeah.
But how do you manage that? How do you not let that baggage like kind of pull you down? It's self-care. This all comes, and nurses are notorious for not taking care of themselves.
Yeah.
I'm a huge advocate for just, I just talked about it this morning when I was on a podcast, which was sunlight, movement, community, nutrition, and sleep. Those are the 5 pillars that sustain any human being. And if you can get those at least somewhat in line, it's going to help you so much more. So if you're taking care of yourself, you're going to be able to better take care of other people. If you are constantly neglecting yourself, your own needs, and the needs of a human, which is those 5 things I just mentioned: sunlight, movement, nutrition, sleep, and some sort of social support.
Yeah.
If any of those are missing, you're going to suffer, and it's going to negatively impact the way that you care for others. Because then when somebody comes to you with something that's very burdensome, you're going to feel like, this shit again.
Yeah. It weighs heavy on the soul.
It weighs heavy.
Yeah.
Instead of you thinking more proactively and how do I help them? What resources do I have to connect them to? Is there anything in the community that I should be teaching them about that they should go upon discharge or when they leave this office space?
What are some resources that you think are always going to be beneficial for your patients that you know that are within the community? Because right now I feel that, again, we're just starting, so I feel like it's interesting to talk to you about all these things.
Toastmasters.
Toastmasters, what is that?
Toastmasters is a place for people with social anxiety or difficulty with public speaking. Like right now I'm having difficulty with public speaking. So you go in a room with a lot of people who are just trying to improve their public speaking skills, and they basically practice. And if you Google Toastmasters right now, there's a Toastmasters Tamiami, Toastmasters Miami Lakes, Toastmasters Hialeah, Toastmasters Kendall, Toastmasters West Kendall. I could go on and on. So if you find Toastmasters, all of a sudden you're like, oh wait, everybody's trying to improve their public speaking. Everybody's trying to be better at giving a presentation, because a lot of people get stage fright and they choke up and they start sweating and they get palpitations.
And everybody's at different skill levels too.
For sure.
Yeah.
Yeah. So, and it's perfectly okay to screw up, and then you get feedback. It's not just good job. It's, hey, you could have done this better. It's constructive. They want to build you up. So one community resource would be Toastmasters. Another community resource, some that cost money, BNI, I think is great for networking. So Business Networking International, and again, it's the same thing. Everybody has 30 seconds to pitch their business or their line of work. And then one person for that week gives a 5 or 7 minute presentation on their business. That's another great thing to not only network and meet people, but also practice your public speaking. Learn about other businesses in your community, other business professionals as well. I'm trying to think what else. AA, NA, those are always there, which are great community resources. I'm trying to think for nurses specifically. Nurses don't have any real resources in that sense, but what we do have is a lot of Facebook groups. And Facebook groups actually is full of people who really want to help one another.
Yeah.
So yeah, I think those 3 are a good start.
So I have more of a tactical question.
Go for
So for me, when I do my homework, it takes me, or like any charting, like it takes me a while to do it. And I'm just like, I want to be sure I'm very accurate and very detailed and very correct. Yeah, you know what I'm talking about. So how do you teach your students? Like, is there a template you use for your patient notes? How do you ensure that your charting is done quickly? Is there a system that you use for it? Because I know I can't spend 30 minutes per chart. It's just not realistic.
Yeah, you guys are stepping into a wonderful point in time in patient care. So we do have templates that align and kind of allow the provider to navigate their session with the patient. And then we have tailored AI that actually listens to that conversation and documents the note for you in real time.
Got it. What company is that?
Well, we use Doximity. And it's Doximity AI, which is its beta version. So it doesn't necessarily even pop up on the app, but you call the number and somebody just answers the phone and you're like, hey, this is my name and I have Doximity, but I don't have this option. And they're like, oh, okay, I'll put it in for you. Next thing you know, that part of it pops up.
Got it.
I'll show you right now, actually.
There's like 10 companies that do that now.
Well, there's a ton. Doximity's Doximity was free during COVID. Now there is a charge. I'm not even sure what it is. It might be like $50 a month. But so yeah, just click on Scribe, and I'll just click on Take Notes, and I'll say, hey, this is Jack. How are you doing today? How are you feeling?
Doing good.
Doing good. I know that you've been having issues with you've been having some issues with alcohol. How's that going?
Well, I don't drink, but I do. Let's say yes. I have a lot of issues with time management.
Patient is in denial of his alcohol use. His family member actually called and let us know. That's the collateral information that we've received. He's binging about 20 drinks a day. And that's it. We just continue with it, and then you
press stop,
you hit generate note.
And that's how you do it. And then how much editing does that need from there?
If you follow the template that we have in the chart,
got it.
It's money.
Really?
It's
wow.
Money. Like you basically don't, and it'll even write out what you're going to see. It's going to give a diagnosis, and as we're talking, if I would have talked to you about naltrexone or something, it would already put it in the plan. If I talked to you about AA, it would put it in the plan. So like summarize.
So how much time do you spend? So like patient summary, subjective, objective assessment. Wow.
And you could change the type of note too. You could make it an intake. You could take.
And that's your template. Is that just wow?
See, alcohol use this more treatment. Discuss the potential need for interventions addressing alcohol use disorder, patient education,
that's nuts.
Patient. Yeah. And that was not even a minute. That was less than a minute, and it's already generating a note.
A whole note. Yeah.
And we went on for 30 minutes. Everything is there. Mm-hmm. Whereas if I was documenting that very same note, there's so much information that would have been missed or nuanced information that the AI picks up.
Yeah.
It's everywhere.
So how much time do your providers spend on, or how much would you recommend, like if I'm starting out, I'm brand new, right? How much time would you recommend, what's a good benchmark for amount of time per chart if I want to get, in the beginning?
No time. You use AI.
No time? Okay.
Yeah, use AI. I'm not even going to play with it.
Okay.
Yeah, I would definitely revise it and look over. So maybe 3-4 minutes, making sure that everything lines up correctly.
What if I didn't use AI in the beginning? How much time would that take per note?
You're going to be so slow.
Really? Okay.
Oh, yeah. Unless you have templates that you could just click.
Yeah. Got it.
I can't tell you that AI is not going to mess up.
Yeah.
And now you're going to hear this is where there's going to be pushback, right? Mm-hmm. You're going to have these old school clinicians be, oh, no, you have to learn to document for yourself. Yeah. Why? I have a calculator, basically.
Yeah.
So now you're going to tell me that I have to do all this long math, otherwise I'm dumb. No, I have a tool. I'm going to use that tool. And yeah, I'm going to know how to document on my own, but this is going to do it far better than I can.
I'm trying to think of this, when I become an NP in the future, how I'm able to look at my patients and get them the proper diagnosis that they need at that time.
Yeah.
Because there's a lot of people that end up saying oh, I have this sort of condition, and then it ends up manifesting as something else. So again, how do you do it? How do you do it?
You just got to be objective in the moment.
Mm-hmm.
What the patient is presenting with, document accordingly.
Mm-hmm.
And again, there's plenty of unspecified diagnoses or just generalized diagnoses that you could just go with that as opposed to labeling them with something. But for the most part, it's going to be, most of your population is going to have generalized anxiety disorder, major depressive disorder, less of the mood disorder. It depends on what population you're serving.
Mm-hmm.
I wouldn't jump to labeling them with or diagnosing them with any sort of personality disorder unless they have a history of that. But I would leave that up to a psychologist who does extensive testing and really figures out what that is or what's going on with the patient. Yeah. Because some of these labels, as they go on to different centers, they might follow them, and then people just follow what the medical record shows without really doing a deep dive and saying, oh, wait, how did they come up with this diagnosis and what's going on? They just take that label and carry it.
Yeah, makes sense.
Yeah.
But are there any like guidelines or like protocols that you like rely on for treating all the major disorders?
No, there's not. I mean, obviously there's guidelines for treating all disorders.
Yeah.
Mostly like it almost formats like an algorithm for each one of them.
Yeah.
Yeah. I think the most important thing that people struggle with is probably that initial encounter, the initial evaluation. Understanding that as a nurse, you're asking a lot of questions about their life, their religion, and you're kind of just entering it into a system.
Yeah.
And it's kind of irrelevant unless you got to call a chaplain or call a priest or something along those lines. But for the most part, you're just taking in information and you're entering into the system to say you did it.
Yeah.
In psych, all of that information is pertinent because you're trying to paint a picture for yourself of what this person's life is like at home.
Got it.
And you want to immerse yourself in this person's life so that you understand, how do they view the world? What is their environment like? Our environment shapes us a lot.
Yeah.
It has a huge impact on how we behave and what we do and how we think. So understanding their background, their culture, how is that impacting them? How is that influencing their view of even seeking mental health treatment? So I think if there's any advice I would give you is to really dive deep into an initial eval.
Okay.
And looking at like, why are these questions part of this? Because they're not just for shits and giggles. They're there for a reason. They're there because we really want to understand the patient and how what their day-to-day life is like.
And what are some of the best questions that you asked that you kind of thought of or created that aren't typical, or maybe they are typical, but you just like them the best?
Well, there's always questions about social. I mean, all the questions are very relevant, like I said, but the questions about social support, I think, are huge.
Okay.
Because I started to realize like how many people go home and don't have any real person to go to. So I would always ask, hey, if you're having a really bad day, who do you typically go to just have a conversation?
Yeah.
And so often you get
nobody. Yeah.
No one.
Yeah.
No one. And it's like, oh wow. So let's go back to those 5 pillars and say, well, social support is huge. You need more help with that.
Yeah.
Because you could have sleep, movement, good nutrition. I already forgot the other one. Sleep,
nutrition,
movement, good nutrition, no social support, and
sunlight.
Movement. Sunlight. Sorry. So yeah, you could have all of those. You could have sunlight, movement, good nutrition, and sleep, but you have no social support.
Yeah.
And it's like you're missing a huge component of what it is to be a thriving human being.
Yeah. No, I've been there before with the social support part. Yeah.
Because we isolate ourselves sometimes.
Yeah.
And that's depression almost forces. For some reason, depression forces us or makes us do the exact opposite of what we should do. Mm-hmm. We regress. We isolate. We go into a dark room. We don't want to talk to anybody. We don't want to express what we're experiencing. It's the exact opposite of what you should be doing. So yeah, definitely an initial eval, definitely social support. Never hesitate to ask any question on the exam. I'll never forget having a relatively young gentleman, and I'm not even going to describe him, but very successful. He came in just for ADHD, wanted to renew his Adderall. He's a brand new patient to me. And one of the questions I asked him was, hey, I'm just going to go through all these series of questions. Just answer a simple yes or no. And if you want me to skip it, feel free to ask me to skip it. And one of the questions I asked him was, have you ever been physically, sexually, or emotionally abused? And he just stopped and he said, yes. And then he paused, his eyes watered, and he's like, I've been coming to psych providers for I don't know how long getting my Adderall, but I think because of my status in life, nobody ever asked me this. And he's like, and it's something that I haven't wanted to kind of face, but now that you ask me, I think it's something important for me to see a therapist about. And so even though patients are going to come in and feel the most stable or appear the most stable or feel like they have their lives together and just coming for a refill, it's still important to be thorough and really assess them appropriately.
Got it.
And just be matter of fact. This is objective. You're not judging them. There's no bias. You're just, hey, I'm just trying to do my job as best I can, and I'm here to
Yeah.
help you. And if you're offended by any questions, that's not my intention. My intention is to help you. And if
Got
you
it.
want to skip the question, please, by all means, just ask me to skip it. I'll skip it.
Got it.
How do you stay up to date when it comes to research in psychiatry, current medications that can be very beneficial for your patients? What resources do you usually use?
So typically, I mean, Stahl comes out with new texts almost every year, and Stahl is like the Bible for us. I don't know if you guys use Stahl. Stahls, Stephen Stahl, I believe it is. So that's
Yeah,
like the
okay.
Bible of what we all use. And if you look at Stahl's prescriber's guide, is what I recommend. Excuse me. That's what I recommend any
Okay.
provider have at their hip, ready to use, because.
Interesting.
And
Okay.
never be hesitant about using one of those tools in front of a patient, right? Because you could use that to educate them.
Yeah.
The way that Stahl's is written, you could easily say, hey, let's go over the side effects. And when you look at what to do when you start taking it, there's 3 bullet points that say, wait. And literally, he put those in there. And I love showing that to patients. I'm like, listen, it's written here.
Yeah.
So what other tools? I think it's just keeping up with different journals, attending conferences. There's always going to be marketing agents that come in, your drug reps.
Yeah.
And obviously they're doing a job and they're trying to sell you a drug that they want you to prescribe, because then they are compensating for how many prescriptions are written. You do not get any bonuses for that. I know, contrary to popular belief, some people think, oh, you're just working for big pharma. No, I mean, you're just trying to do what's good for your patient.
Yeah.
And so I think listening to them, but then also doing research on your own on that drug. One thing I will say is, if a drug is brand new, sometimes I'm very hesitant unless I've tried multiple other drugs within that class before I jump to that new drug,
Yeah.
just because there's so many things that are tried and true. But if there is a patient that I have that's suffering from the side effects of this initial drug, and this drug in particular is saying, oh no, it doesn't cause, let's say, tardive dyskinesia for an antipsychotic. All right, let's try. Let's see how it goes. Let's see how how you feel as a patient. If the insurance covers it and everything is good, then let's give it a shot. But at the very beginning, that there's a reason why there's always a protocol in terms of the insurance companies want you to use what's tried and true first, right? That's why you need a prior authorization before you go to this brand new drug that costs $1,200 a month. Yeah.
So, so I know when I graduate as when we graduate as, psych MPs, there's like a 6-month process before you can actually start seeing patients as and billing insurance and everything, pass the boards. Okay. Then, the DEA, and then the actual getting credentialed with insurance. Is there anything that to expedite that process? Is there anything that I can do while in school to expedite that, or
that you got me there?
Yeah.
The main thing I will tell you is this: if you graduate, you pass your boards.
Yeah.
I would definitely tell you to get credentialed immediately. If you start looking for a job and you don't see that, and there's no bites, nobody wants a new grad.
Yeah.
Instead of just waiting around for 6, 8, 10 months for somebody to hire you, go ahead and get credentialed, and that's going to make you more marketable.
Got it.
And that's the advice I give to everybody. Now, is it an investment on your part? It's probably like a $3,000 investment.
Yeah.
So to get credentialed with almost every insurance panel. But that $3,000 investment up front can probably gain you $10,000 or $15,000 in the first year, just because
Completely.
now you go and you market yourself and you let them know, hey, I'm already credentialed. I'm ready to go.
Tomorrow,
I can
yeah.
start in. So
Yeah.
if
you
you're
have
not
to get with the practice.
yeah, if it takes you, if you are not credentialed, it's going to take you 3 to 5 months to get credentialed,
Yeah.
right, through that company. Now, if you come on board on your own and they hire you, you're already credentialed. It's 3 weeks, 2-3 weeks for them to just bring you onto their panels because you're already done. That's huge.
So if I did that myself and I credentialed myself, would that be? Do I do it as a solo practitioner, or how would that? Because I thought you have to have a you have to have
A group MPI.
Yeah, like an MD above MD to even get credentialed.
No, they're
No.
only Blue Cross,
Okay.
Blue Shield, and Medicare. I think the only 2.
Got it.
But even if that is part of the investment, it's still worth its weight in gold, because
Got it.
you could find a collaborative agreement for $400, $500, $600
Yeah.
a month which sucks. You also have to pay for malpractice insurance, which sucks.
Yeah.
But those initial investments all together as a package, you're going to be much more marketable.
Got it. Okay.
Yeah, you're going to get your foot in the door much easier
Yeah.
than coming in clean slate, nothing is done, just smiling.
Yeah.
I have my boards done, I'm good.
Yeah.
No,
Exactly.
it's not going to work.
Got it.
Yeah, so I think that's something that a lot of people should know, and it's going to save them a lot of time, a lot of heartache,
Yeah.
and it's going to save them from being rejected from a lot of places of employment.
Yeah. 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 Completely.
If you come to me brand new to my practice, and I have one person who has 2 years experience, but they're not individually credentialed, and I can't bring them on for 5 months, and you're a brand new psych MP, but you're credentialed, and I can bring you on in 3 weeks, I'm going with you. I can train you from zero.
Yeah.
I can bring you in right away. We can start billing for insurance within 3 weeks, 4 weeks,
Yeah.
and that's it.
Good to know.
Yeah.
Good. Thank you.
Yeah, for sure.
Interesting. Okay.
These are things that nobody told me before. I learned
Yeah.
because
This is
from being in it. Yeah.
What do you feel about nurse residency programs?
I think nurse residency programs are awesome.
Okay.
I think if you have a good mentorship program, it's going to be worth its weight in gold. When I did pediatric ICU at Jackson Memorial Hospital, there was a 6-month fellowship, and I think it was worth every second that I spent in it, because it really prepared me beforehand to get oriented to what was going on.